Hey, and welcome to the She Found Motherhood podcast. Today, Dr. Sarah and I, Dr. Alicia, go over PCOS and its effects on fertility. We talk about what PCOS is, how do we diagnose it, what are some signs and symptoms for you to watch out for, and how we can help manage it to help you get pregnant more easily. So we'll get to all of that right after this. If you're thinking about getting pregnant or early pregnant or struggling with infertility, then make sure to check out our friend Noelle's course at Nourished Beginnings Pregnancy. She is an amazing dietitian and has created a course with everything you need to know around nutrition in preconception, pregnancy, and the postpartum period when you're breastfeeding. It's a comprehensive course, and she's given us our She Found Health a 20% off code. So SFH20, and you can find the link in our bio. Welcome to the She Found Motherhood podcast. We are Sarah and Alicia, two doctor moms who are creating a community rich with high quality information to support people through the journey from pregnancy to parenthood.
Our goal is to empower with knowledge and decrease the anxieties during this time in our lives. We cover topics from fertility through the 4th trimester, with the odd birth story sprinkled in.
Come join us on Instagram or Facebook at she.found.motherhood, or check us out on our website at www.shefoundhealth.ca.
Some of these podcasts have been sponsored, which allows us to continue putting out free, amazing content. But don't worry, this won't affect our advice or recommendations, and we only partner with companies we know and trust, or have come highly recommended to us by you, our listeners. She Found Health is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information you hear does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions that you may have regarding a medical condition. The views expressed by She Found Motherhood and our guests are not representative of any institution with which we are affiliated. Welcome to the She Found Motherhood podcast. Today, we're talking all about PCOS, polycystic ovarian syndrome. PCOS is a common condition affecting approximately 5 to 10% of women. It results in irregular menstrual cycles and increased level of androgens, which are also referred to as male hormones. It's caused by an imbalance of hormones and metabolism. These result in changes that can affect a woman's health and appearance. It is also a common and treatable cause for infertility.
PCOS is a variety of symptoms that can come together, and not all women experience the same amount or severity of symptoms. Common symptoms experienced include irregular periods, excessive facial hair growth, acne, thinning hair in the same pattern as we would see in male pattern baldness, and obesity. How do we diagnose PCOS? Well, people who have PCOS must have at least 2 out of 3 issues. Number 1, chronic lack of ovulation or anovulation, which leads to the irregular periods. Number 2, chronic high testosterone levels, either by checking it by a lab test or the signs associated with it, which are hair growth, like facial hair growth, acne, or male pattern balding. And number 3, ovaries with multiple small cysts, i.e. polycystic, that are either seen on ultrasound or during surgery.
So, a lot of you are probably wondering, how does PCOS affect fertility? Well, because of the hormonal imbalance present, women with PCOS often do not ovulate regularly or at all. So what can often happen is that they're actually having periods, but they're not ovulatory. They're just withdrawal bleeds, so the lining grows thick enough that it just starts to shed. Because of this, normal levels of estrogen, progesterone, and other hormones become imbalanced. Androgens, the male hormones, may become overproduced because of the imbalance of hormones, as well as obesity. We also see increased insulin levels that can occur with this that trigger even more testosterone to be produced. So if you do not ovulate, which means you don't release an egg from your ovary, it cannot be fertilized and you cannot get pregnant. The irregular hormones also don't trigger your lining to prepare itself for implantation.
So now we know a little bit about what PCOS is and how it can affect fertility, but what about other health concerns that PCOS can cause? So PCOS can often result in higher insulin levels, and insulin acts as a key to our cells. It helps to open up the door to let sugar or glucose from our bloodstream into our cells so it can be used as energy and also stored for the future in the form of fat. Obesity can lead to insulin resistance. So our cells don't want to open up and let in more energy because they're already full. So the key that opens the door needs to be bigger and stronger to open that door. And as a result, our body needs to produce higher levels of insulin to let the sugar into our cells. If we cannot get the sugar into our cells, then our blood sugar levels rise, and this is what causes diabetes. Another issue that's associated with both diabetes and with PCOS is cardiovascular or heart disease. Women with insulin resistance or diabetes have a higher risk of coronary artery disease and heart attacks. This can be decreased by losing weight and ensuring that you don't have increased blood pressure or high cholesterol, and also by improving your blood sugar levels, either through diet and exercise or through medication if you need some more support.
The other health concern that PCOS can cause is sleep apnea. This occurs in up to 50% of women with PCOS. And sleep apnea additionally increases the risk of obesity, insulin resistance, and cardiovascular disease above and beyond the risks that you might already have from PCOS and obesity. If you're concerned about sleep apnea, you can get screened for it. Things that should increase your suspicion for this is if you snore, if your partner tells you stop breathing at night occasionally, or if you awake frequently at night, or you feel really tired and not rested during the day.
Something else we often don't think about is the increased risk of endometrial cancer or uterine cancer. The lining of our uterus is meant to regenerate monthly and slough off the unused lining in the form of a period. If we're not regularly ovulating, our uterine lining continues building up and not sloughing off as it should. Over time, these cells can change into cancerous cells as they're not supposed to be sitting around for so long. There's a higher risk of endometrial cancer in women with PCOS as they typically only have 6 to 8 menstrual cycles a year. Some women with PCOS have normal menstrual cycles, but they may notice that if they gain weight, that their cycles become more irregular. Another issue that we often don't discuss is that women with PCOS also have higher rates of depression and anxiety, sexual dysfunction, and disordered eating. So please, it is so important to discuss these issues with your care provider if they are a concern for you.
So let's go on to talk about treatment. The first management for PCOS, if you're obese, are lifestyle modifications. Ensure you're eating a healthy diet and getting regular exercise. There are extra supports around this if you need them, including getting a dietitian and exercise prescription experts. Many women who lose even 5 to 10% of their body weight are able to regulate their hormones on their own. Now, we know this is really challenging, which is why we encourage you to reach out to some of those extra supports.
So if you've lost the weight and still your cycles are irregular, or if you're unable to lose the weight on your own, our next goal is to start to regulate your hormones. Some of this, like I said, may occur with weight loss and lifestyle modification and by improving your insulin levels and a result of your other hormone levels. But if not, then we have medications that we can use to help support your hormone levels and as a result, lower your testosterone levels, which should improve acne, hair loss, and unwanted facial hair growth. This medication also helps to protect your uterine lining and prevent an unplanned pregnancy. These medications involve both estrogen and progesterone, replenishing what your body is not naturally producing in the form of birth control pills, the ring, or the patch. Now, if you want to get pregnant, obviously, putting you on the birth control pill is not going to help. The first-line treatment for fertility in PCOS is weight loss. As previously discussed, even 5 to 10% loss of your body weight can help you get back on track with regular ovulation. Even if the weight loss doesn't help with your ovulation, it does really help with your overall health, your chance that fertility treatments, if you need them, will work, and it also decreases your risk for a complication of pregnancy and decreases your risk of needing a cesarean section at delivery.
Now, there are additional medications that we can use to help. Metformin is a common medication that can be used to help regulate your blood sugar and therefore your insulin levels. And interestingly enough, this may also help restore your ovulation. This is something that you should definitely talk to your physician or care provider about. The other medication we can use is called Clomiphene, which is used to stimulate the ovary to release 1 or more eggs. It typically helps ovulation in about 80% of women with PCOS, and about half of these women will become pregnant. If these medications do not work, we recommend seeing a fertility specialist for more individualized treatment. Now, something important to know about Clomid is you heard me say it can release 1 or more eggs. And what can happen with Clomid, Alicia?
Twins.
Triplets.
Or more.
Exactly. So just something to be really mindful of.
So we've discussed what PCO is, how do we diagnose it, what are the common symptoms and signs of it, why it affects your fertility, how it can affect your health long term, and how we can kind of help manage it. But one really important piece of the puzzle is, when do we refer you to a fertility specialist? And so this is going to be very different for different cases. Generally speaking, for the general public, we refer women under the age of 35 if they've been trying for a year and haven't gotten pregnant. Or if you're over the age of 35, if you've been trying for 6 months without getting pregnant. But if you're not ovulating regularly, it's really hard to get pregnant. So if you realize you're not ovulating regularly, seek help before you hit that 6 to 12 month mark. And certainly, if you haven't been trying those lifestyle modifications, get working on those while you're waiting for your fertility referral, because maybe you won't actually need any support if you can lose some of that weight and get your body back into that ovulatory work.
Yeah. And, even if you're not yet at the stage where you're planning a pregnancy and you're just starting to think about it, but you've listened to this podcast and you started to say, oh, I have acne, I've got some facial hair, then don't hesitate to reach out to your provider, because, getting a diagnosis early and starting to optimize your health is only going to help you, not just from a fertility perspective, but also from a general health perspective.
So there you have it, PCOS and fertility in a nutshell. If you need a little bit more support around what you need to do if you're preparing for pregnancy, check out our free download. We'll link it in the show notes below. It's great. It's got all kinds of tips and tricks on what you want to do to make sure that you're ready to get pregnant. So we hope that was helpful, and keep your eyes out, because we're going to do a podcast on PCOS and pregnancy and breastfeeding and what we need to do about that in the near upcoming future. Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood, and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.